Hello, I'm Carrie Ann Hausman, and I will be presenting my research proposal, which is examining the iron supplementation during pregnancy and the decreased occurrence of postpartum depression. So, what will be covered, we'll be looking at iron in pregnancy, iron deficiency in pregnancy, postpartum depression, anemia and postpartum depression, some barriers for prenatal supplementation, and then the proposed study design and the proposal. So, iron recommendations throughout life can vary. For women 14 to 18 years of age who are not pregnant, it's 15 milligrams per day. For women 18 to 50 years of age, it's 18 milligrams per day. And then for pregnant women 14 to 50 years of age, that jumps up to 27 milligrams per day. So you really see that increase in the recommended dietary intake. So, why is that? Iron in pregnancy. So, pregnant women are among the most highly susceptible to iron deficiency. Iron plays a couple different roles in the body. It's involved in oxygen transport, DNA synthesis, and also electron transport. The majority of iron in the blood is found in hemoglobin, which is actually what gives blood its red color. And hemoglobin is involved in transporting oxygen through the blood to all the body's tissues and organs. So, consequently, if you have a lower hemoglobin store, your tissues and organs are not getting adequate oxygen. So, increased intake of iron is necessary during pregnancy to compensate for the extra hemoglobin needed to deliver oxygen to the fetus. Iron deficiency in pregnancy has numerous different side effects. They are nausea, dizziness, difficulty breathing, fainting, heart palpitations, sleep difficulties, weakened immune system, increase in infections, low birth weight, fetal morbidity and mortality, intrauterine growth limitations, and prematurity. And then, of course, we'll be looking at the effect of postpartum depression. So, postpartum depression usually begins 4 weeks after delivery, and then the severity and the duration of it can vary from mother to mother. Currently, 10 to 15% of mothers worldwide are affected, and research shows that 20% of maternal deaths after delivery are due to suicide from postpartum depression, which is a pretty shocking statistic. The symptoms of postpartum depression vary drastically. So they can include difficulty sleeping, exaggerated concerns for the baby, mood swings, lack of interest in daily activities, increase or decrease in appetite, feelings of hopelessness, fear of injury, thoughts of death and suicide, and then in some cases, suicide. So we looked at two studies that was examining the connection between anemia and postpartum depression. One of them was the association between a maternal anemia and postpartum depression in an urban sample of pregnant women in Iran. This study was conducted in 2013 and found a correlation between hemoglobin levels below 11 grams per deciliter and postpartum depression. The second study was postpartum depression risk factor, a narrative review. And this review was conducted by the University of Medical Sciences and also looked at the correlation between hemoglobin status 7 days after delivery and the rates of postpartum depression 28 days after delivery. So both of these studies requested additional studies to be conducted for further evidence due to their limitations. But they both did. The first study found anemia, regardless of iron status, affected the mother's emotions after delivery. So even if it wasn't a postpartum diagnosis, it was, still influencing her emotions. And then that second study found that mothers who had low hemoglobin levels after delivery were more likely to demonstrate postpartum depression symptoms. So some barriers for supplementation. Across the board, recommendations are pretty well known that if you're pregnant, you should be taking a prenatal vitamin. However, currently we only have a 72% compliance rate with this. So only 72% of pregnant women are following these recommendations and taking their supplement. So how can this study help? We are hoping that, with having further evidence that connects iron supplementation and postpartum depression, that'll really encourage medical providers to increase their recommendations and their discussions surrounding prenatal supplements with mothers in hopes that more mothers will comply with this recommendation. Currently, some of the barriers for supplementation are education surrounding the supplement, no immediate side effects for having low iron levels, access to supplements both geographically and financially, not enough emphasis with discussions from the healthcare provider, which is what we're helping to improve, and then also the supplement's physical taste and appearance. So why is further research necessary. So postpartum depression, like I said, is currently affecting 10 to 15% of mothers. And not only are the mothers who are diagnosed with postpartum depression affected, but it's affecting, the child they're rearing, their partners, their entire family structure, and in turn society as a whole. So addressing postpartum depression and hopefully finding ways to diminish the number of mothers and families who suffer for it can really have a beneficial outcome. And then, of course, if prenatal supplementation would really diminish those numbers of families suffering from postpartum depression, it'd be an easy intervention to help and prevent further numbers. So the proposed study is a quantitative non-interventional study. It'll be conducted at Cheshire Medical Center, Dartmouth Hitchcock Keene, and it'll be assessing pregnant women 18 years and older who do not supplement with iron versus those who do, and the occurrence of postpartum depression. So inclusion and exclusion criteria. Inclusion is pregnant women, 18 years of age or older, who are receiving their obstetric care at Cheshire Medical Center. Exclusion criteria would be women who are not pregnant, women who are under the age of 18, and women who are receiving that obstetric care elsewhere. So procedure, we will gain approval from Mary Woods IRB to conduct the study. Of course, compliance with Cheshire Medical Center will be necessary. So we will have a 6-month rolling admission into the study. So patients who are receiving care at Cheshire can come into the study during that 6-month period. As new patients come on, within that 6 months, they can also join. So we'll have one meeting per month. At the meeting, we'll discuss the study, what their participation would be, and then what the study is hoping to, examine and help with. So they can come to one meeting, they will decide at the meeting if they want to participate or not, and they will say if they want to receive contact via email or mail. They will receive 2 things from us, the survey on current supplement use, and then also the Edinburgh Postnatal Depression Scale. Both of these will be completed in their home, and that's to ensure accuracy in answer and then also privacy. And then the third thing we'll collect is the hematological values from the routine medical appointments, which will monitor their hemoglobin levels as well as their iron stores. So this is the Edinburgh Postpartum Depression Scale. It is 10 questions. It's pretty user-friendly. They will complete it during pregnancy and then again postpartum, so they are familiar with the study. And then again, completing it at home for accuracy and privacy. So what is this study going to show us? What will we gain from it? So the questionnaire assessing whether or not the participants are taking any supplements, that will help us to see, what percentage of pregnant women are following the supplemental recommendations. The Edinburgh Postpartum Depression Survey and Supplement Questionnaire will show us if women supplementing with iron during pregnancy are experiencing lower instances of postpartum depression. And then the hematological data and the Edinburgh Postpartum Depression Survey will show us are women who have anemia experiencing higher instances of postpartum depression. So ideally, this study is going to show us, if women are supplementing and if that supplementation and the adequate iron levels and stores are resulting in a lower instance of postpartum depression, if the iron supplementation is protective to postpartum depression. So this can really have a large impact because hopefully with our findings, it's going to encourage medical professionals to encourage their participants more to have that conversation about the importance of supplementation. And then also hopefully mothers, if they become aware of this study, will want to, improve their supplementation during pregnancy to hopefully prevent the risk of postpartum depression. And then also with lower rates of postpartum depression, the children who are being raised in these families are set up for a better situation, and also the families will hopefully be avoiding postpartum depression and won't have that weight on their shoulders. So here are our sources. Thank you.